biggest difference between the Institute for Peak Health and your traditional medical office would be that we focus on something called functional medicine. Functional medicine is where we work at looking for the root cause of issues as opposed to giving you a remedy for a symptom. This is real personalized medicine. I love that I can spend a lot of time with my patients. Whatever it is that they need, I have time to address. If they have a question or a problem, they can reach out to us.
They were by my side every step of the way. If I had questions, I could call them. They were great.
I do get a lot of time with Dr. Thomas, not only in her office face-to-face, but phone calls. And that really surprises me because you don't get your normal doctor that calls you and asks you how you're doing.
All of the staff was really great. They answered my questions. We had a shopping class, which was great because they actually went to the store with us and they showed us, this is how you read the ingredients. This is what's important. These are the foods to eliminate. These are the foods to keep. That was phenomenal. We had exercise classes. We had a cooking class. There was just so much that is there and that was available to help me to be able to succeed in whatever it was that I was looking to achieve.
So my favorite part about being a provider is spending time educating my members. In naturopathic medicine, we have a Latin term called docere, which means doctor as teacher, and I take that role to heart. Being a doctor is also being a teacher, so my office is really a classroom for members to learn and learn more about their bodies and their conditions. I believe that when people understand more about their bodies or about their conditions, they're able to do more about it.
Peak takes an approach to help the whole person. It's not just focused on, what's wrong with you, but it's more focused on helping you establish a healthy lifestyle.
There definitely is a better way to help people by putting that prescription pad away in many cases. Your hands are not tied to this 7-minute office visit. You really have time to learn what's going on with the patient and why the body is sending those signals that something is just not functioning right.
Dr. Thomas is walking this path with me and showing me the way, not only with me, but showing me where I can be better.
And you work with them on many levels, on fitness, on lifestyle, on sleep, on stress reduction, on all of those foundational pillars that everyone needs to be healthy, and then people make a wonderful turnaround. They're revitalized, they're energetic, they're sleeping well, they're losing weight, and guess what? Those symptoms start to go away. It's very rewarding.
It's bringing in those lab results. So comparing old lab results to new lab results, seeing the major difference that it brings and sharing that with the patient. When I show them a negative result or a lowered result and they get so excited, that makes me excited as a provider, knowing that we helped achieve that as a team and you worked hard for it and you earned it.
It's only been 3 months and I've already seen dramatic changes in my body, and it's just amazing.
I always was able to speak to somebody. I was never left out there to do this alone. It was a we program instead of a me program.